His name is Mechai Viravaidya, a respected Thai politician, but more affectionately known as Mr. Condom.
We want you to have fun and stay safe.
He's handed out millions of them in his personal crusade against HIV/AIDS, offers them by the handful to sex workers, street vendors, truck drivers, always with a smile and good humor. He'll even blow them up as balloons for passing children. In Mechai's view, you're never too young to learn that condoms save lives.
At the end of the day, is this still the #1 weapon?
That's all we have at the moment.
This is the weapon.
This is the only thing. I call this a lifesaver.
In fact, many say Mechai himself is the real lifesaver here. He's the one that encouraged Thailand to confront the disease head on, right from the beginning.
It was here in the lively streets of Bangkok that HIV/AIDS first surged into Thailand in the mid-1980s. It turned out to be something of a deadly perfect storm.
With its vast commercial sex industry, a thriving gay community, and a growing subculture of intravenous drug users, the infection rate soared. Within a decade, AIDS was the country's leading cause of death. There was fear and denial at first, but Thailand soon became a role model for the rest of the world, responding to the disease with compassion and commitment.
We said this is an emergency. Everyone needs to stand up and fight, and that's what we did.
Following Mechai's lead, Thailand launched a nationwide campaign, aimed not just at high-risk groups, but the entire population. In addition to the condom campaign, government and private industry financed AIDS education, public relations, and research. And voluntary HIV testing was promoted and encouraged throughout the country. The rate of new infections began to plummet, from 140,000 a year in the 90s to about 20,000 a year now. And when the new antiretroviral drugs began showing promise, Thailand made a controversial decision to defy the major drug companies and make its own low-cost generic copies of the drugs. Most Thais living with AIDS today now receive those life-saving drugs for little or no cost.
But despite all its successes, Thailand is still struggling with some of the problems that go hand in hand with HIV/AIDS the world over. The fear and discrimination that drive the disease underground, and the complacency that sets in when it's no longer on our front pages and television screens.
You can see the problem clearly at the Lopburi Buddhist Monastery, where many AIDS patients go to die when their families no longer want them. The wards here are still full, with patients who forgot or never learned the lessons of the past 2 decades. These men almost shrugged off their infections. One admitted with a laugh that, yes, he had visited a few prostitutes and didn't use a condom. Another admitted using needles. He's a heroin addict. In the next ward, 2 women infected by their husbands. Non Lak, like many wives here, had no idea she had HIV until her husband got sick and died. By then, she had full-blown AIDS. And because HIV testing seems less urgent to many Thais these days, thousands of infected mothers are passing on the disease to their children.
All these children have the virus.
There are more than 15,000 children living with AIDS in Thailand. Father Joe Meyer, an American priest, runs a hospice that cares for the poorest of them. Most are AIDS orphans. The new medicines have helped the children live longer, but the drugs are too powerful for some, and drug resistance is rising.
It used to be they would come in and die, and they still do, but now the oldest one is 15, almost 15. We've never had one live past 15.
While Thailand gets well-deserved credit for its early approach to AIDS, Father Joe says the growing number of infected children is living and dying proof that more of everything is needed. More money, medicine, education, and political will.
Governments and people, AIDS is here. It's knocking on our door. It's not going to go away.
And that's why Thailand's tireless AIDS activist Mechai Viravaidya is still out on the streets, handing out his beloved condoms, raising awareness whenever and wherever he can.
Why you not come last night?
Don't forget that everyone needs to be involved in trying to prevent AIDS. Doctors can't do it, nurses can't do it, politicians alone can't do it. We need everybody involved. It's total war.
Total war. So grab a handful of condoms, Mechai says, and join the fight. I'm Mark Litke reporting for Worldfocus in Pattaya, Thailand.